Namaskar. Welcome to Ek Samvaad at Arunima Ankuran. Today we are in conversation with Dr. Ravneet Kaur about transfusion medicine and much more. So our guest for today is Dr. Ravneet Kaur, Professor and Head, Department of Transfusion Medicine, GMCH, Chandigarh. It's such an honor to have her here with us today. Thank you so much for joining in, Doctor.
Thank you, Pragya, for inviting me. It is really honor and privilege for me to be here.
Wonderful. Welcome. And a word about Arunima Ankuran. This is an initiative for positive social change through self-development. The goal is greater well-being and happiness for all. At Arunima Ankuran, we believe that each person is unique and special in some way, that each person can make an impact, that each person can make a difference, and that's what keeps us going.
So, Pragya, I would like to compliment you here for starting this platform. I think this platform really gives confidence to one. When I got an invite for this platform, for a moment, I also thought, am I so important? And really, it gave me a confidence and a boost. And I said yes to it.
Such a delight to have you here. Thank you so much.
Thank you.
Uh, so the talking points of today's Samvad are, we'll talk about some of the milestones of Dr. Ravneet's journey so far. What is transfusion medicine? Whom does it help? What inspired her to choose transfusion medicine? In 2008, what was her role during the outbreak of dengue in the region? During the COVID-19 pandemic, what were some of the challenges that she had to deal with? So, um, let me ask you to introduce yourself through these milestones to begin with.
Yeah. Uh, I'll start from my schooling. So I did my schooling at different places in Punjab, Himachal, as my father was on transferable post. So then I joined my MBBS at Amritsar Medical College and passed it in 1990. So I did my post graduation after 6 year gaps of my passing out of a MBBS, and that too when my son was 3 years old. That was in 1997. I passed it in 2000. And then after that, I joined the Department of Transfusion Medicine, Government Medical College Hospital as a senior resident. And since then, I am working in this department, and slowly and steadily, I have risen to the highest post in this department, that is Professor and Head as Department of Transfusion Medicine. So I proudly say that I am involved with the teaching, research, and clinical aspect of the transfusion medicine. We have postgraduate students, and every year I mentor 5 students. It gives you really good satisfaction. And I also happen to be an editor of Asian Journal of Transfusion Science from 2012 to 2017. So one of the program, that is your Hemovigilance program of India. So this program is basically about the reactions which happen in the recipients or the donors. So we try to capture all those reactions. We capture the reactions from all over the India, the blood centers, try to analyze them and try to learn from them so that we stop them from reoccurring again. And again, I would proudly say that I was awarded J.R. Jolly Award by Indian Society of Immunohematology and Blood Transfusion at 37th National Conference for vital contribution in transfusion medicine.
Wow, congratulations, Ravneet. And it's so amazing. You're talking about it so easily, but what you have done, your achievements are totally, mind blowing.
Thank you. Thank you so much. Thank you, Pragya. I mean, you have given me opportunity to bring out my all the positives. I had to really think and write about it. So I think that is the positive about this platform.
Thank you, Ravneet. That's really very heartening to hear from you. And You talked about transfusion medicine and you talked about your tremendous achievements. So, belated congratulations to you.
Thank
Um,
you.
to begin with, we would like to know what is transfusion medicine and whom does it help?
So basically, transfusion medicine is all dealing with blood banking. Now, earlier, the concept of blood bank was just to take a blood from the donor, do the blood grouping, and issue it to the patient. But now the scope has widened because we are concerned about the safety. We are concerned about the judicious use of this scarce resource. So the ambient of this transfusion medicine has increased a lot. It involves basically testing of the blood beyond the ABO blood group systems. In our body, we have about 36 blood group system. I think in journal, people know about one ABO blood group system, that I am AB positive, O positive. And the second thing they talk about, that they are positive or negative. But we in the transfusion medicine talk beyond that. We try to look for more blood group systems for patients who are multiply transfused. Then, to make the best use of this scarce resource, these days, all the blood units which are collected, so they are basically separated into different components. Like a whole blood unit which is collected from a donor is separated into red cells, platelets, plasma, and other components like cryoprecipitate, which is rich in factor 8. So basic objective behind this is to give the desired component to the required patient. So beyond this, we also check each unit for transfusion transmissible infections. So we want the blood to be safe. Then we are also involved in the preparation of apheresis units. I think all of us have seen the dengue outbreaks in different areas of the country. And during this outbreak, we know that there is the need of platelets. So here the platelets, they are prepared with special equipments which are called cell separators, where the donor is directly connected to that machine with the help of some kit. And we collect the desired component, that is only the platelets from the donor, and return rest of the blood to the donor, and that platelet part, which is very pure and good quality platelets, that is given to the patients. So this is seen more when such like dengue patients, chemotherapy patients who require such components. Beyond this, we are also involved in your stem cell collection. So these days, for bone marrow transplant, which are done peripherally with the help of these cell separators only. And a lot of things like this are happening, that these days we are talking about, from donor management, we are talking about patient blood management in transfusion. So patient blood management means that patient's own blood is also very important to us. So we need to preserve that blood also. So earlier we were talking only of donor blood, right? We want to collect safe blood. We want to have judicious use of collected blood. But now we are saying that we need to preserve patient's blood. We should not make patient land to that stage that we require transfusion. So basically, here the role of prevention, here the role of therapeutic medicines. So this is all is the transfusion medicine.
Wow.
So this transfusion medicine field basically has its own importance, because that we have made a lot of advancement in science, but till date we have not been able to find any substitute of blood. So if any patient requires blood, somebody has to donate blood, and we have to give that blood only. So there are n number of patients like your trauma patients. So trauma patients, if one trauma patient comes to my hospital, that patient may require 10 to 12 units, blood units on spot. Then there are pregnant females, bleeding pregnant females. Sometimes they land up with postpartum hemorrhage or some other complications. So they also require good number of blood units. Then we have cancer patients who are on chemotherapy. So such patients, when we give chemotherapy, their bone marrow gets depressed. Bone marrow is basically our factory where all these cells are generated. So that get depressed because of the chemotherapy. The red cells production, the platelet production, it get depressed. To support such patients during chemotherapy, we have to give one or other blood component. And of all the things, the most important category where we issue blood units are your small thalassemic children. The thalassemic children are children who are not able to make their red cell right from the birth. And such children, they basically need transfusion every 3 to 4 weeks throughout their life. So these are the all conditions where we issue blood.
My goodness. हम लोग ने जो मूवीज में देखा है ना, इट्स अ वेरी टिपिकल काइंड ऑफ थिंग दैट वन पेशेंट इज
Yeah.
लाइंग on the bed and उसके पास में the donor is lying and then they put a tube across and so talk to us about how it actually happens. Is there any truth in that, and how does it really
No,
happen?
ideally there is no truth in that. Ideally, we cannot, the blood which is collected from the donor has to be mandatorily subjected to certain tests. Blood is a drug. It is considered as a drug. It is a therapeutic thing which we are giving. So it comes under the Drug and Cosmetic Act, under the rules. So we are regulated. So we know all the blood centers need to have a license, which is basically checked. The working of the blood center is checked every yearly, and every 5 yearly that license is renewed. So we have to perform under some strict regulations. We cannot issue any blood unit without performing the mandatory test, which includes your test for transfusion transmissible infections, the 5 infections, which are your HIV, hepatitis B virus, hepatitis C, syphilis, and malaria. So performing this test under a quality condition, I would say, would require some time. So it is not possible that you just collect the blood and then give a transfusion on the other side. So you have to perform this test, and these tests at least take, I would say, 4 to 6 hours to perform. Another thing which has now come up, that you should not transfuse fresh blood. Transfusing fresh blood has its own complications. They say that because it contains certain viable cells, viable lymphocytes, which can basically harm the patient. So ideally these days, this concept is not there, and we always send our messages across that the pictures which are shown in the film, जो movies में दिखाया जाता है, वो ठीक नहीं है. It doesn't give a good impression to the patients, to the media, to the I would say masses.
Yes.
So it is a wrong concept, totally a wrong concept.
Another thing, while we are still talking about blood donation, Ravneet, tell us about who can donate blood and how frequently you can donate blood, so that anybody who's listening in and wants to do the same, they get an idea.
First of the thing is that for blood donation, we always talk about voluntary blood donation. We want people to voluntarily come forward, the healthy people of the society, to voluntarily come forward and donate blood. We don't want that we should stress any patient's relative that you donate and then only you will get blood. So these kind of donors, they are called replacement donors. The reason behind this is that we think that the voluntary donors, they are healthy donors, they are safe donors, and if they have some problems, some issues, they will definitely come about it. They will definitely come and tell to the doctor who is screening them. Like before donation, we screen each donor. We ask them certain set of questions. So we expect a truth from that donor. So we expect that a voluntary donor is healthy. He doesn't have any problem. On the other hand, a replacement donor, a relative of a patient or any other replacement donor is one thing, he's already under stress. We
Yes.
don't want to give him more stress. Second thing is, in stress, thinking that if I don't donate blood, my patient will not get blood. So he may try to conceal some things. So we basically want a voluntary blood donation. And especially, as I told you, in thalassemia case, the children require 3 to 4 weeks interval transfusion. So how can you tell a parent of a child that every time you come, you bring a donor? So as per Government of India also, we are supposed to provide them free of cost blood and on voluntary basis. So anybody who is healthy, who is above 18 years of age, who has a weight of 45 kg, who has a hemoglobin more than 12.5 gram per deciliter, and can donate blood. He can donate blood. If he's a regular donor, he can donate blood up to 65 years of age. And if he's a first-time donor, he can donate it up to 60 years of age. And each male can donate blood after every 3 months. And each female can donate blood after 4 months. Beside this, there are other criteria which are looked by a doctor who is taking a blood donation. So he will ask you certain set of conditions, certain figures, like certain questions. Maybe it is regarding vaccination, maybe it is regarding your health, maybe it is regarding fever, cough, a lot of other things. So those things also we have to consider. And if we find a donor to be healthy, then he or she can donate blood. Another important point I would like to stress here is that donor should not be fasting before the donation. So if you plan to go for a blood donation, you must eat well. And you must eat well. I'm explaining you with one of my experience. Like I was sitting in one blood donation camp a few years back. And one female, a girl say 19, 20 years girl came and she said, I want to donate blood. There was a lot of rush in that blood donation camp. I asked her, have you eaten something? She said, no, I have not eaten. I said, okay, there is a refreshment going on. So you just take some refreshment. You take banana, I explained her well. She came back to me. I asked her, have you eaten something? She said, yes. I believed her. I took her donation, but almost when her donation was at, you are going to donate 350 ml of blood. So as she was donating, she started feeling giddiness, fainting, and she was not able to get up. And she basically, then I asked her again. I rushed to her bed where the donation was going on. I asked her again, "Aapne kha liya tha kuch अच्छे से?" She said, "हाँ, खा लिया था." मैंने कहा, "क्या खाया?" कहती, "2 बिस्किट खाए." So my point here is that you should eat well. You should drink good amount of. You should have a good intake of water, so that you don't feel any giddiness or such things. And one thing is more that you should have some gap, say 15-20 minutes or half an hour gap between your meals and donation. Because sometimes if you go immediately for donation, when blood is taken, ideally the blood which we draw, that is 350 ml or 450 ml, depending on the weight of the patient and the requirement of the blood center. So that is something 1/3 of some surplus blood circulating in our body. Okay. So that once the donation is taken, the body takes little time to recirculate, to redistribute that drawn blood. So that is why we tell the donors to keep lying for 10-15 minutes so that there is redistribution of the blood which has been drawn. So sometimes if you get up and if you have taken food and suddenly there is a low supply of blood to your stomach, to gastric, so there can be chances of vomit. So all these things, if are taken care, this procedure is very, very safe procedure. It hardly takes half an hour to complete the whole procedure, right from your registration to your donation to your post donation, everything rest. The needle, mostly the donors, they have a fear of a needle. अगर कोई उसकी
Yes.
needle देखता है ना, वो बहुत मोटी सी बैग के साथ needle attached होती है, तो लोग बहुत डर जाते हैं उस needle से कि इतनी मोटी needle. So basically needle मोटी इसलिए रखी जाती है because we want to draw a good amount of blood in a limited time of 7 minutes or 10 minutes. We want immediately to draw it and to mix it with the anticoagulant so that it doesn't get clotted, because आपने देखा है, when moment the blood comes out of the body, it gets clotted. So that is why that is little big, and that process is just 7 minutes, 7 to 10 minutes. And this, you really feel, I don't say there is a pain when the needle goes inside your body. Anything which will go inside your body will cause a pain, but that pain is just for a few seconds. And I tell you, if you donate blood and if you get up, once you donate blood, you have a different feeling and you just totally forget about that pain, which is just for a second, and not too much. It's just a bearable pain. And by bearing that pain, if you are saving life of 3 to 4 patients, so you are, because it gets separated into components. Red cell will go to one patient, platelet will go to the other patient, plasma will go to the other patient. So it basically, you are saving 3 to 4 lives just bearing a small pain, and you forget about all that once you donate.
Wow.
So my request to all this thing, that you should come forward for blood donation.
Yes, I think that's a strong message that we can share with everybody who's listening in, right? And is there any group which should not donate blood also?
Yeah, there are causes of permanent deferral. One thing is that if you ever had suffered from jaundice, because there are certain diseases which can be transmitted through blood, right? So it is not that we are concerned of collecting blood, we are concerned about collecting safe blood, right? So we want that safe blood is there. We should not harm the patient, right? So anybody who has suffered from jaundice, so we expect that he might have suffered from infections of hepatitis B, hepatitis C, which are transmissible through blood. So that donor may be healthy, but he may be carrying minutest amount of that virus because his immunocompetent system is good, but patient's immunity is compromised. So when that minute amount will even go, that may cause harm in the patient. And other thing is, of course, I told you that we are performing tests for these 5 diseases: HIV, hepatitis B, and hepatitis C. But these tests also have limitation. They cannot provide 100% protection, because there is a window period which we call as that is a period in which the infection is there in the person, but that is not detected with the help of test. So that will go undetected. So that is not causing any harm in the donor right now, because he is healthy, his immunity is strong. But when it will go to the immunocompromised patient, it will cause harm to the patient, right? Then other conditions, we are also not only concerned about the safety of the patient, we are also concerned about the safety of the donor. We don't want to create another patient. So the donors like having a HB less than 12.5 gram. So this is a temporary deferral of cause, right? They can improve their hemoglobin and they can come forward to donate. But others, like who have thyroid, some medication is going, or who is having some heart problem, if that is going. But if anybody is suffering from blood pressure, common problems are your blood pressure and diabetes mellitus.
Right.
So there is certain group of patients, donors with suffering with this diabetes mellitus or hypertension, who can donate blood, but they have to tell the truth to the doctor concerned. So he will assess whether he is fit to donate or not and take the donation.
So, this is not a very commonly known branch of medicine, if I may say so. Although everybody knows about blood donation, but it's mostly limited to that. So, how did you take it up and what inspired you to get into this area?
I told you I have almost 20-year experience now in this branch. So I did my MD in pathology. At that stage, the MD transfusion medicine did not exist. It was only the pathologists who were taking up this specialty. So I finished my MD pathology from Patiala in 2000. I came to Chandigarh. I was looking, in our this we are always at day zero on every step. So first, after doing junior residency for 3 years, you are okay busy, but after that again you have to start from day zero. So I was looking for some job. So I came to know that one of post of senior residence is vacant, and they are looking for some senior resident in the for transfusion medicine. I met one of she's still my mentor, Dr.Neelam, who was head of the department at that time. And she introduced me to this subject, and she told me that if you are interested, you come and join. So I took it. She said, you'll have to leave your pathology. Be very clear on that you'll have to leave your microscopes and come out of it. I said, it's okay. I said, I'll join. So believe it, I was the first senior resident in that department where I joined with ma'am. And slowly and steadily, I started developing interest in this. It was really a challenging thing that on one hand, you have to deal with the donors. On the other hand, you also had the laboratory work to do. You had to prepare blood and do everything. And then you also come in contact with the patients. Like if any patient has transfusion reaction, so you have to go and you have to do everything. So I found it to be very interesting and challenging, going to the community, having contacts there, going in camps, gave you a recognition that this is a new doctor. So I developed interest and I continued with this. I never missed. People used to ask me, don't you miss your microscope? Don't you miss your pathology? So I said, no, I am enjoying. There were my colleagues who left in between who said, no, we want to go back to pathology. But now this branch has risen. So slowly and steadily, we started post-graduation in this branch. The curriculum was developed. So now about, I think, more than 20 to 25 medical colleges in India have this post-graduation. So a lot of postgraduate students are there with MD transfusion medicine. So
that's great.
That is the way I opted for this.
When we look at all the work that you've done in 2008, particularly, you were talking about it earlier also. What was that experience? Talk to us about that during the outbreak of
that
dengue.
was the first I would say challenge which I faced. The one thing was that a few months back, I would say 1 month back only, my HOD had left for ex-India leave, maybe 2 years. So I was made an acting head. And this was the first time when a dengue epidemic was seen. But I had not seen so many cases of dengue ever. So that was the first time when there was an outbreak in the region. And there was like platelet everywhere. If you used to move out of your room, people used to fall in your feet that we need platelet. So such was the situation. And it was really challenging. And we developed a system to have a voluntary panel of donors for platelet donations. Because before that, we were only talking about blood donation. But then we felt that we also need to have donors for platelet donation. And I am really thankful, or my thanks to Almighty, that I am sitting in a region where people do understand voluntary blood donation. यहाँ पे अगर रात को भी एक डोनर को हम कॉल करते हैं ना कि आज इस ग्रुप के लिए प्लेटलेट डोनेशन में सबसे ज्यादा ये होता है कि you need to have a group specific donation. Basically, if patient is A group, you will have to have a A group donor only.
Usi ka same
so
match.
To have one pan, same match. So it is very important. So we prepared the voluntary list, we called the donors, we helped the patients. And at the same time, I motivated my staff. I mean, day and night we worked. I used to stay in the department till late night. And I think it was the teamwork which helped me and which helped us to overcome that. And after that, we have seen many outbreaks, many seasons of outbreaks of dengue. But we are prepared now. We are already prepared. But that was the one where we were not prepared. And we did all, and it was a teamwork which helped me. All my staff was there. Like if I had to change, we have to run services 24/7. I still remember that I had to put some staff members on some odd duties. Like one was that I want to cover this part. So I asked somebody like 3 to 9 duties. They used to raise hand, ma'am, I'll do this duty. Ma'am, I'll do this duty. So that was it. Maybe we were, and another challenge which we faced during this time is that there is an outbreak in community and our donors are to come from community. So they are also affected, right? So some of them are also having symptoms. They cannot come forward to donate. So we have to look for healthy people, motivate them, because our donor base also gets shortened because they are also, many of them are also suffering. There is an outbreak of disease, right? And many of your staff members, their family members, they might also be down with the disease. So it's a teamwork which helped me to overcome that challenge.
This is really, और ऐसे शायद ट्रांसफ्यूजन मेडिसिन में आने का एक तरह से, it must have been such a good feeling that.
Yeah, very good feeling. And as a acting head, when you got this opportunity, and there was real enthusiasm and zeal in me also. So probably that all helped me to overcome that challenge.
Wonderful. And what was your experience in the pandemic? How was that? How did you deal with the challenges?
Again, pandemic was again a very challenging situation. It was a different kind of a challenge for us. So first thing was sudden lockdown was announced, right? So when lockdown was announced, we had sudden closure of all the hospital, other facilities. Like in our hospital, like any trauma was stopped, the routine surgeries were stopped. So we had certain stock of bloods. So one challenge was not to let that blood expire, right? So we had certain group of patients like thalassaemic children. They needed blood. Although it was pandemic, they needed blood. Their disease was going on. They needed support. Pregnant females, they needed support, right? Cancer patients on chemotherapy, they were taking their medicine. They needed support. So then we channelized our inventory. We made it so that, and I tell you, we were not able to, we were all manage our inventory and not able to discard even out because of outdating even a single unit. So this was the first thing. And second thing was how to get more blood now.
Yes.
See, yes, people are inside. It's already a lockdown announced. Nobody's coming forward to donate. Nobody's ready. Nobody can organize blood donation camp. There was no permission, right? And if we used to call anybody, the other thing was they were scared. No. Hum hospital nahi aayenge. They were scared of infection, getting infection. So slowly and steadily, with the help of, we had some stocks. So first thing was we sent a message through our director, through our administration, to our resident doctors, to our families who are staying in the campus, their families, their doctors, our employees. So for a 1 month, 2 months, I was able to manage with them because our demand had also dropped. Little bit demand had dropped. Earlier, if we had a demand of, say, 60, 70 units, we had a demand about 20, 30 units, only for the group of patients which I told you. So we managed with them. But then after that, now what to do? So we got permission from administration to send a bus to collect the donors. So we used to make a route plan of the bus in the morning, right? Our bus will now move from this sector to this sector and to this sector and collect the donors. We used to contact the donor one day before that our bus will come to pick you up and drop you back. Where our doctor used to go with one person who used to sanitize the bus time and again, right? Because we have to follow all the norms
Protocol.
to have a confidence of a donor to sit in the bus. How can he will not be ready, because he would say otherwise I would get an infection, right? So he used to go, doctor used to screen the donor, check the temperature, and make them wear masks, sit them at maintain social distancing, and slowly and steadily, and in the hospital also we made a special route through which the donors will come. So it was a separate route from the patients, so that then they started having confidence, like we can go to this hospital to donate. And our message at that time is that it is only social distancing and not social disengagement. So this was the message we tried to spread among the donors, and we could come out of this. Another challenge which was there, that when camps were allowed, then we were allowed to hold a small blood donation camps. Guidelines came by Government of India. Okay, you can have small camps, and you have to follow these protocols. This is a policy. You have to maintain social distance. You're not to have a gathering. You have to use sanitizer. And all those guidelines they came over. So then staff was little, because see, you must have observed that during pandemic, if any doctor has seen any patient, they used to say, "पहले इसका COVID test करा के आइए." अभी भी कहीं जगह कहते हैं कि COVID test करा के. But we could not say it to our donors because they are not patients.
They're helping
so
you.
We had to basically manage with social distancing and taking all the precautions, making them also realize this, and making our staff also realize this. And slowly they also got confidence, started going into the community. We used to go into community at that time. You alone cannot do all the things. It is together that you are able to achieve everything. So that is it.
But leadership has a very big role to play. The leader has to take all the initiative, and the innovative ideas have to come from the leader most of the time.
Yes.
So
So small things we have to take care.
Yeah, so talk to us about those small things.
It just came to my mind, like we always give a donor refreshment. We give a refreshment to the donor, though it is not required, but we just want a donor to be under our observation for some time, so that if it doesn't develop any kind of a reaction, any adverse event doesn't act to the donor. So the small thing which we had to take in this case was, we immediately contacted our dietetics department, and we told them to give us a packed refreshments, right? So they used to put that refreshment in a small brown lifafas, and it used to come, give them packed, so that they are, see, it was said now it is get transmitted through touch. Earlier it was like that. So the owner used to come and pick up that refreshment himself or herself from that thing. Then another thing is, we used to give them, if you have seen that when a donor donates, we give them a ball in a hand to press, so that there's a good flow. So we had balls put up in sanitizer, and used to tell them to pick them, so now these are the things which gave them a confidence also, that they can come and donate blood. So then earlier we used to have bed sheets on the tables, but then we shifted it to the disposable sheets, right? So that we used to remove whenever each donor used to donate, we used to remove those sheets and change that to those disposable sheets. Small things which we took. I still remember, we just at each day we had to take some action to motivate donors to come forward to donate blood.
What an amazing job, and really hats off to all those people like you and your team and other people who have been doing this kind of work also. So you have had so many different experiences. Talk to us about some of the feedback that has remained with you. जैसे कभी-कभी patients आके आपको बाद में बोलते होंगे, या उस time भी, when they express their feelings. Talk to us about some of those experiences.
देखो, patient जिसको blood, those who are in need of blood, those who are in need of component, when they get it in time, or when they are given it, arrange it from somewhere, I mean, there is a lot of satisfaction with them. They really thank you, especially these thalassaemic children with rare group. So mother, she comes from Gurgaon. Other parent brings the child from Jhansa to us. Their parents, their children are O negative group. Other parents' child is A negative group. So they have my phone numbers, so they can call me at any time, and they tell me, ma'am, we are coming tomorrow. We want to come on this date. Kindly ensure that blood is arranged. So this kind of a bonding you have with your patients, and it really makes you satisfied that you are doing a good job for patients.
Absolutely. So, if you were to share a message for everybody who's listening in, what would that be?
So my message, one is to the for blood donation only, that all should come forward, should donate blood. They should think of registering themselves for donation of apheresis platelet at the nearest center, especially the individuals who have rare groups, who have negative groups. The negative groups are very rare, especially among the negatives also AB negative is the rarest. So such persons should keep them on emergency panel at the nearest blood center. Because if you see, if the donors are less, then the number of patients are also less. That means the percentage
Right.
of this group in your population is less. So we don't want to collect more of blood from these rare group donors. We want them to come forward at the time of need. So they should register themselves at the nearest blood center and donate at the time of need. Another message my would be to the anybody who's studying, the students. You should have a good dedication to do the work in whatever branch you are. You should put in 100% of your effort. You should not think that I'm in this branch, I'm in that branch. Put in your 100% of effort and do best, achieve best. So that should be totally 100%, nothing less than that. And that will help you to reach at the top in that branch. And that is what you want. So it is better to be doing best in any branch. So if you are a surgeon, it would not be good if you don't know a good surgery. But
Yes,
if you have put in your 100% and a good surgeon, then that is more important.
absolutely.
That would be my messages.
So, any particular experience that you want to talk about before we conclude?
I would say that I remember one incident was when I was in 10th class. I was a good student, used to stand, score good marks. I appeared in board exams, CBSE exam. It was in Ropar. My father was posted there. So my result came. It was at that time the result used to be published in the newspapers. So my
Yes.
result came, and my marks were, very less as compared to the others. I was very upset. I was really disturbed. How is this possible? And can you imagine, after a few days, the mark sheets came to the school, and there was a misprint in my result in the newspaper. So
Okay.
it was 587 and it was printed as 537. So that 3 and 8 was misprinted. And I can't tell you, I still cannot forget that incident, which gave me that happiness in my life. Yeah.
Because the
Suddenly
effort,
exam popped up.
huh?
It is your hard work which pays. So don't believe. Then I started believing more in it, that
Yes.
it always pays.
Absolutely. And okay, also, during the course of your study of medicine, are there some teachers that stand out in your memory?
Yeah, I would say I have only one mentor, Neelam Marwaha. I told you that she has been my mentor throughout these 20 years. I'm in touch with her. She's retired now. Touch with her. She's just like a motherly figure to me and guided me at each step, given me a lot of opportunities. She said, you can do this. You have to do this. Even for when for I had to file a paper for nominations of editorship, she only called me. No, you have to do it. You can do it. So that is the person who I cannot miss. I owe all to her.
That's amazing. And also, when we were talking about it initially, you said that after 3 years of the birth of your son, then you joined the course and completed it. So, how challenging was that experience and how did you cope with that?
It was a big challenge. I got married in my internship. I got fixed up immediately after completing internship. I got married. My husband was doing a post graduation at that time in Amritsar. I was doing his MS orthopedics. So I somehow there could not study. But after the birth of my child, I thought of studying. At that time, also, we used to have to pass the entrance test to get admission in the post graduation course. So, whenever my son used to sleep, I used to study, spend that time in studying. But I think I had a good support from my family, from my mother-in-law. She was a professor and head of gynecology at Government Medical College, Amritsar. So she also supported me a lot. She used to say, "Jaake pad le, don't worry about anything else. Go and study." Even when I started doing my post graduation, at that time also he was 3 years old. He started going to school, so I had to look after his teaching part also, his schooling part also. So at that time also, again, support from my mother-in-law and my mother. My in-laws used to stay in Mohali, and my parents used to stay in Chandigarh, in Patiala. So I did my post graduation in Patiala. So 5 days my mother used to take care of my child, and 2 days my mother-in-law used to take care of my child. So with their support, I think I was able to do everything in my life. With my mother's support, my mother still stays with me, and she's a great source of inspiration for me and for my family. So I owe to them, both of them, that people say that you should stay in nuclear families. I don't believe in that. I believe it is better to stay in joint families. You have a good support. Your children are looked after by them. At any stage till 10th, my son never started in any tuition. It was only in our guidance only he was studying. And reason being is that support from the family. They used to say, now you have come back from the work, go and look after your child. Make him study. Make him sit and make him study. Don't worry about anything else. So that is the kind of support you get from the family. And I think that helped me a lot.
Yeah. So now tell us, what is this boy doing? The boy who came into your life.
I'm a very proud mother. My son he is in Indian Revenue Service. I would say he was a bright child throughout, very obedient, docile child throughout. And he never, people say na कि हम अपने बच्चे से तंग. I would never say that. I'm always proud of him. मैंने जितनी देर I used to make him sit and study, he used to study. Only thing I made him to be regular in his studies. And I think that and the support of my husband and my family, we were able to bring him good. He did his, he was a Tri-City topper in 10th class. Then he did his IIT. And finally, he cleared his UPSC exam. And now he's an income tax commissioner. And happily staying with us and enjoying his life.
This is a little digression from what we have been talking about so far. But because a lot of parents pressurize their children into choosing a specific profession, particularly when both of you are doctors. So, how was your experience regarding this?
See, a lot of people ask us about this. Both being doctors, why didn't you make your son doctor? I don't know. Maybe it was that the family was both of engineers and doctor. My father-in-law was engineer. My brother-in-law is engineer. My brother is engineer. My mother-in-law is doctor. My husband is doctor. Somehow my husband had a feeling that doctors have a little tough life, more of legal implications. So he was a bright child. Wherever, in whichever stream he would have gone, he would have done, I mean, excellent. And if he has gone into the stream, he has done excellent. So, so maybe that is the reason that I don't have any specific thing to explain. But I think in due course, it took over like that, that he has to go into this stream, and he has to go into non-medical, and he has to do this IIT. After doing IIT, again, there was a confusion whether you want to go to US for further your studies, or you want to have this kind of give this entrance test. Okay, I'll give one attempt. He cleared in that attempt. So we never pressurized him,
Very
I never even never pressurized him. I never stopped him from anything in during his
Hmm.
childhood also. लोग बड़ा कहते हैं कि हमने अपने घर के टीवी के कनेक्शन कटा दिए, हमारा
Ah,
बच्चा पढ़ नहीं रहा है, हमने ये कर दिया, वो कर दिया. No, never like this. Because he was regular in studies. जितना टाइम उसने पढ़ना है उसने पढ़ लिया, उसके बाद वो टीवी भी देख सकता है.
cool.
So never like this. I think when you stop certain things, the children get more attracted towards those things. कि पता नहीं उसमें क्या है, and they're more towards that कि हमें वो चीज करनी है. And in their absence, in your absence, they start doing those things. So never try to stop anything. Rather, make them understand. Beta, this is the time when you need to time spend on studies, and this is a time when you can spend time watching TV. So you can better discuss with them, make them understand, and the things have to come from themselves only. You should not force them. So that is only by understanding and making them feel about it.
Oh, I'm so happy that you're saying this, because this is what Arunima Ankuran keeps talking about all the time, that everybody is special and unique, and let them discover themselves. That is
Yes, yes.
wonderful.
Never force anybody for anything. Rather, you can guide them. You need to guide them. You cannot let them go like this, do wrong things. You have to, at points, if they are doing wrong, you have to stop it. You have to discuss with them. You have to tell them, okay, this is wrong. So you have to give the guidance, but not to force them.
Yeah. So, what an amazing combination you are of a positive parent and an amazing doctor. Thank you so much for being on Ek Samvaad. It was so lovely talking to you, and I'm sure
Thank
that
you so much. Thank you. And it was, I would say, a great kind of experience, and really made me feel that I'm important.
of course you are.
Thank you so
And
much. Thank you. Thank
welcome,
you.
and thanks from Aruni Mankuran for your time, and wishing you all the
Thank you.
best in your journey onwards.